My name is Ann Plemons and I'm here to present a little information about the Jackson-Pratt drain. The Jackson-Pratt drain, also known as the JP drain, is a closed drainage system that does not need gravity. Prior to the 1970s and the development of the JP drain, dressings were applied to post-surgical head wounds after brain surgery and left in place. This created a potential for infection and indeed was a huge problem in those days. The JP drain provides gentle negative pressure to pull drainage out of a wound or cavity. So the JP drain was an exciting advancement in the 1970s and still being used extensively for the past 4 decades. Now, why should this be important to me? While there is little clear evidence-based statistics on infection rates comparing results with or without the use of the JP drains, the drains have been adopted by many surgical disciplines with the premise and goal of decreasing post-operative infections and keeping readmissions to the hospital at a minimum. This is a crucial turning point in the patient's process of learning to care for the JP, as this is the time in which the patient comes to the realization it'll be up to him or her to take on the responsibility for his own JP and wound care. It is a time of resignation and acceptance of reality for the patient. The patient can also be discharged with the JP drains to recuperate at home and have the drains removed on return to the doctor's office at a follow-up visit. While an inpatient, the patient's knowledge of drain care can be challenged and evaluated throughout the patient's stay and also at discharge, making sure that the patient learns the information given. Jackson-Pratt drain care teaching can be initiated immediately after surgery, reinforced during the patient's hospital stay while the patient adjusts to the newly acquired drains, and by discharge will be able to comfortably, efficiently, and independently care for the drain. We must, as caregivers, remember to emphasize and encourage the patient to be aware of certain critical points of the care we teach, as shown on this PowerPoint. Let's review with a short video. Of note, there may be variations of instructions in this video that may or may not be accepted at your institution. However, it is almost identical to the instructions and policies at my institution, so I feel comfortable using it in this PowerPoint. Now let's review with a little quiz. Why do I need this little piece of equipment? What should I do if I have swelling or more pain at the site? How often should the JP drain be emptied? One last encouraging note. Things do get overwhelming for the patient at discharge. So much information and so little time. But remember, you are not alone. Caregivers are always available by phone, and you have written instructions just in case you forget a small detail. Happy healing. Thank you so much for your time. Any questions?